A radiographic exam of the abdomen, or KUB, is an examination used to evaluate the area for any causes of pain or to examine the organs. KUB stands for kidneys, ureters, and bladder. This X-ray is usually one of the first procedures used to examine the urinary system. This procedure is done by having the patient take off anything that could possibly interfere with the procedure. While sometimes the patient may be positioned on their side or standing up, it is most common to have them lay on their backs on the X-ray table. The X-ray is then taken while the patient is fully inspired in order to compress the organs so they can all be seen in one single image, as well as helping to avoid any movement from the respiratory system. The average abdominal radiograph delivers a dose of radiation to the patient equal to 75 chest radiographs, or the equivalent to 1/6 of a CT scan of the abdomen. So it is only used when appropriate, like all other ionizing examinations. The risk involving radiation dosage is outweighed by the benefit of finding out what is wrong and treating it before any severe problems may occur. Also, like other ionizing procedures, it is important that this exam is not done if the patient is pregnant, has an IUD, or if they have a specific medical condition that would cause harm if the procedure is done. Some other things that should be mentioned before beginning the procedure is whether or not the patient has had a barium contrast X-ray within the previous 4 days, or if they have taken any medications like Pepto-Bismol, which can interfere with the X-ray. The results from a KUB exam can vary. A normal result will show everything looking according to how it should look with the patient's age. An abnormal result could be a multitude of things, including kidney stones, gallstones, a mass, a foreign object in the intestines, buildup of fluid, or intestinal blockage. The test can be administered to locate something the patient swallowed, or even to make sure a tube or catheter is in the right position. The KUB exam is taken in a portrait orientation with the iliac crest positioned in the center of the radiograph. The top of the exposure should ensure that the upper poles of both kidneys are in view. The exposure is typically around 70 to 80 kVp, but this may need to be adjusted according to the patient's size or depending on the imaging system. In conclusion, the kidney, ureter, bladder examination is one of the first procedures used to diagnose a variety of issues that could cause problems for the patient. It is primarily performed with the patient lying on the X-ray table with their back against the table. While this exam is ionizing, the benefits are worth the hypothetical risk. As you can see, the KUB is an important examination used for many purposes.